Assalamu alaikum, students. So today we will discuss the aorta. Okay, so aorta is the major blood vessel coming from the heart. Aorta begins at the upper part of the left ventricle. So it begins from the left ventricle. And after passing upward for a short way, it arches backwards and to the left. So it begins from the heart and it arches backwards and to the left side. It arches backwards and to the left. It then descends behind the heart through the thoracic cavity to the left of the thoracic vertebrae. I will show you in the coming pictures. At the level of 12th thoracic vertebrae, mind you, at the level of 12th thoracic vertebrae, it passes behind the diaphragm, then downwards in the abdominal cavity to the level of 4th lumbar vertebrae. So it passes through the diaphragm at the level of 12th thoracic vertebrae. So it's an MCQ question that at what level the aorta passes through the diaphragm, where it divides into right and left common iliac arteries. Again, at the 4th lumbar vertebrae, it divides and the terminal branches, and it gives the terminal branches. So right and left common iliac artery is the terminal branches. So again, an MCQ can be asked that aorta gives terminal branches at the level of fourth lumbar vertebrae. Fourth lumbar vertebrae. And the terminal branches are right and left common iliac arteries. Now, among the other branches, we can ask the question that what are the terminal branches of which of the following is a terminal branch of the aorta? So, right and left common iliac branches are the terminal branches of the aorta. Now, throughout its length, the aorta gives off numerous branches. Some of the branches are paired, means there is right and left branches, and there is right and left branch of the same name. For instance, right and left renal arteries supplying the kidneys, and some arteries, they are unpaired. For example, celiac arteries. The aorta will be described here according to its location. So, describing the aorta according to its location: thoracic aorta and abdominal aorta. So thoracic aorta, if we talk about the thoracic aorta, this is the part of the aorta which lies above the diaphragm. This is the part of the aorta which lies above the diaphragm and is described in three parts: ascending aorta, arch of aorta, and descending aorta in the thorax. So three parts: ascending aorta, arch of aorta, and descending aorta in the thorax. Now, ascending aorta, this is the short section of the aorta that arises from the heart. It is about 5 centimeters long and lies well protected behind the sternum. So, immediately behind the sternum lies the ascending aorta, which is again an MCQ question. Right and left coronary arteries are only its branches. It's only branches that arise from the aorta just above the level of aortic valve and supply the muscles of the heart, that is the myocardium. Now again, an MCQ question can be asked about the branches of the ascending aorta. The right and left coronary arteries. So arch of aorta, this is the continuation of the ascending aorta. Let me erase the lines, properly do it again. Okay, so arch of aorta, this is the continuation of the ascending aorta. It begins behind the manubrium of the sternum. So you can see here the ascending aorta and then the arch here. This is the arch. This is the ascending aorta and this is the arch of aorta going on the back of the heart, descending through the back of the heart in the thorax and then entering the opening in the this diaphragm and then descending as the abdominal aorta. Okay, it runs upwards and backwards to the left in front of the trachea. The aortic arch, it runs upwards and backwards and to the left in front of the trachea. It then passes downwards to the left of the trachea and is continuous with the descending aorta. The three branches arise from its upper aspect of the arch of aorta. Now, the branches of the arch of aorta are three: brachiocephalic, trunk on the right side, left common carotid, and left subclavian artery. The brachiocephalic artery or trunk is about 4 to 5 centimeter long and passes obliquely upward and backward and to the right and to the right. And at the level of the sternoclavicular joint, it divides into the right and left, the right common and the right subclavian artery. So the main branches of the arch of aorta are three: brachiocephalic artery, left common carotid artery, and left subclavian artery. And from the right, the brachiocephalic artery arises the right common carotid and right subclavian artery at the level of the sternoclavicular joint. So again, this is an MCQ question that they ask the level of the division of the brachiocephalic artery. Descending aorta in the thorax. This part is continuous with the arch of aorta and begins at the level of the fourth thoracic vertebrae. So these levels are very important to remember. It extends downwards on the anterior surface of the bodies of the thoracic vertebrae to the level of 12th thoracic vertebra, where it passes behind the diaphragm to become the abdominal aorta. Descending aorta in the thorax gives off many paired branches which supply the wall and organs of the thoracic cavity. Now this descending aorta in the thorax, that is the thoracic part of the aorta, it gives many branches. It gives many branches, paired branches in this region, which supplies the wall and the organs of the thoracic cavity. Okay, so these branches are we will do one by one here. The bronchial arteries. Number one, the bronchial arteries, there's a paired branches which supply the lung, the esophageal arteries which supply the esophagus, the intercostal arteries which supply the intercostal spaces, the superior phrenic arteries, not written here, superior phrenic arteries which supply the diaphragm from above. So these are some of the branches which arises from the thoracic part of the aorta, descending aorta. Okay, this is on the 108 page. We can go on this page and revise the branches as well. 108. So bronchial arteries, esophageal arteries, intercostal arteries, and as I have told you, superior phrenic artery, which supplies the, as you can see, now the branches of the thoracic aorta, the part which is present in the thorax of the descending aorta. Bronchial arteries, which supplies the lung tissue, and which supply oxygen to the lung tissue, esophageal arteries, which supply the oxygen, intercostal arteries, which run along the inferior border of each rib and supply the intercostal muscles. Some muscles of the thorax, the ribs, the skin, and its underlying connective tissue. And last is the superior phrenic arteries, which supply the phrenic artery, which supply the diaphragm. So I hope you have understood the aorta, the ascending aorta, and the arch and the thoracic part of the descending aorta. Thank you so much.